My name is Indre Ljungar, and I am working as clinician in rehabilitation specialist in rehabilitation medicine, and I am also an associated professor in rehabilitation medicine at Karolinska Institute. And I will present our one-year experiments of a standardized team-based assessment of suspected ME/CFS in a new ME/CFS project at University Hospital in Stockholm, Sweden. So the talk of the day will be a little bit background behind the ME/CFS project in Stockholm. I will also talk about team assessment, what we're actually doing there. Also our results or that how we see the dynamics behind ME/CFS diagnosis, and also to some words about the advantage of team assessment in diagnosing ME/CFS. ME/CFS project has been started in Stockholm in April 2011. We know that this disease is a very complex disease. It's characterized by a lot of symptoms, what you already know, and a lot of people have mentioned that, so I just skip them. And it makes that clinical picture of a patient is quite complicated and requires a detailed examination as well as exclusion of other diseases and syndromes. We have used at our rehabilitation clinics team-based multidisciplinary assessment and rehabilitation for other complicated disorders such as chronic pain, stress-related exhaustion, post-polio syndrome, brain damages. And we have a good experiments at our clinics of team-based interventions, assessments, and rehabilitations. We also are connected to Karolinska Institute. We are part of Karolinska Institute based at Standardised University Hospital. And we also know that there is missing evidence behind team-based multidisciplinary interventions for ME/CFS patients. So Stockholm County in 2010 decided to establish a team-based ME/CFS project in Stockholm by choosing our University Hospital of Rehabilitation Medicine. And the aims of the project is to improve the diagnosis of ME/CFS patients, to transfer clinical knowledge to the primary care structures, to establish rehabilitation methods for ME/CFS patients, to conduct research on ME/CFS from a broad perspective, including team assessment, biomarkers, and rehabilitation. Our multidisciplinary team consists of clinicians. We have 1.5 positions, and we are both specialists in rehabilitation medicine. We have one position of medical nurse, one position of physiotherapist, who has also knowledge about pain and ICF. ICF is International Classification of Functioning and Disability. We have psychologists. One of them have very good knowledge in neuropsychology and cognitive function. Another is good in diagnosing, for example, neuropsychiatric disorders. We have one social worker, and we have one occupational therapist. And we based ME/CFS diagnosis on the history of disease. We think it's important to see if there was severe infections which resulted into standing symptoms. Also on subjective symptoms, on clinical investigations, which are performed by doctor, by nurse, by physiotherapist, by psychologist. Also, we're performing subjective and objective tests during team assessment. We're also excluding other somatic and psychiatric disorders, and we're considering other important previous investigations, previous treatments, and rehabilitation experiences. We take extended blood, including immune system, and samples, also urine analysis, We also sent, if there is indication, patients to polysomnography to see if there are sleep disturbances. Also, we're doing brain MRI and diagnosis. We're diagnosing according CDC criteria and Canadian criteria. So we have patient almost 3 weeks in team assessment, and patient is coming 2-3 days per week, conducting several tests. So here are examples of our tests we're using during team assessment. These tests are used by occupational therapists. They are standardized tests for activity. A patient has to score activity during 2 consecutive days. We're using also Activity Watch, AMS, which is assessment of process and motor skills, is standardized occupational observation method. We also use other index, what we call leisure time physical activity index, to score physical activity. And our psychologists are mostly looking for that. For depression, we're using different scales, questionnaires. I know maybe you recognize them, maybe not of them, but not all of them, but they are all standardized methods used by used in other teams for rehabilitation or assessing other patients with multiple disorders, for example, pain, or with cognitive disorders with mild traumatic brain injury. And here also our psychologist is performing tests, cognitive test, WISE-3, also another test for cognitive functioning, verbal learning, complex figure test, and also looking a little bit on personality. We have also what you call sleep questionnaire for Karolinska, and we have these tests are mostly for physiotherapists. We are doing profile of physical ability, applying algometry to measure pain thresholds. We're using different scales, visual analog scale and numerical rating scale. And also our physiotherapist is performing Ostrands test, which is standardized bicycle test to measure aerobic capacity and physical condition. We're also using 6 minutes walking test, looking for effort and distance. And also we are working quite much on ISEF profile, which is which means International Classification of Functioning and Disability. The team score the profile of the patient in different functions: cognitive, emotional, fatigue, physical, social factors, social environment. So we started in April. The project was already decided that it will be performed in April in 2010, but it took time. So the project started almost 1 year ago. And here we have results of 100 patients, but we all time getting more and more patients. Maybe now we have 110 patients. And from these 101 patients, 55 patients, they went further for team assessment. And you can maybe wondering why they're going, why not all patients were sent to team assessment. The first visit of a patient was clinical investigation by a clinician, and clinician decides if the symptoms can be related to ME/CFS, or they maybe are not related to ME/CFS. I mean, we as clinicians maybe at the first visit can see that there is very clear another disorder. But in that case, we suspect it, and if we are not sure even about diagnosis, we're sending patient to team assessment, which takes 3 weeks. And from these 55 patients, 33 patients fulfilled criteria for MSFS diagnosis. At the beginning, we used, it was once project started, we used only CDC, but then we, of course, included Canadian criteria, so it's a little bit mixed from the beginning. And we also, due to team assessment, we found other disorders which are very similar from clinical point of view to MSFS. I mean, patients, they look very similar when I, as clinician, meeting them. And if we scoring the functioning by ESF profile, we have really very big difficulties in functioning and disability. But if we send patient to this team assessment during 3 weeks, and we're looking for subjective scoring, for objective tests, we can almost see like a profile that these patients are not MSFS patients, and what they have in that case. I mean, it's a natural question. Yeah, they have psychiatric disorders, and for example, in 10 patients, 7 of them had combination with severe pain syndrome as fibromyalgia. And these psychiatric disorders in many cases were related to stress exhaustion. Since 2003, we have in Sweden diagnosed stress-related exhaustion. We also find 2 neuropsychiatric disorders and also idiopathic fatigue, 2 of them explained by sleep disorders. We also find some somatic disorders, which I did not write here. And these patients who were diagnosed, who were given diagnosis by team MSFS, were offered to participate at rehabilitation, 6 months multidisciplinary team rehabilitation. In other cases, patients were given recommendations what kind of further investigations can help this patient or rehabilitation. So in 17 cases, we could confirm the diagnosis of MSFS given to the patient. In 11 patients, the diagnosis was given for the first time, and in 14 cases, we took away the diagnosis because we saw another disorders which could explain the patient's symptoms. Why it is important to have team assessment in diagnosing MSFS? It depends that MSFS is a very complex disorder with several symptoms involved, and it is advantage to apply several tests, including the objective testing. And we can confirm which patients, they feel very satisfied when we can confirm the subjective symptoms by objective testing. And we can see in which test there are big lags and failures, and where we have to, in which part is cognitive or physical part we have to work more to rehabilitate patients. It also creates an entire picture of the patient, including the psychosocial situation, physical disability, and cognitive functioning. It's also important to identify the major problems and functioning stability for the patient in order to give right rehabilitation interventions. As we feel, we really strongly feel that team assessment creates a more homogeneous group of MSFS patients. What we think maybe it will be very good advantage in further research purposes, for further research purposes. And we always try to give recommendation to afford all help we can to these patients which are not given MSFS diagnosis by after team assessment. And I have one slide which is missed, this is the second version. I can summarize here what it's about. Here is our team. It's Per Julin, who is the leader. It's me. It's Daniel Marotti, who is psychologist. Philip Nu, it's physiotherapist. Annika Frisell is occupational therapist. Marianne Hjelmarsson is social worker, and Susanne Hagman is our nurse. And regarding the research, we do conduct research. All of us are very ambitious in conducting research in this rehabilitation approach. Per Julin is, for example, very interested in brain MRI, so he's responsible for this part, and of course for the whole project. I'm very interested in immunological part, as well as to understand what is happening in the minds of the patients when we take away or when we give MSF as diagnosis, and I will try to use the qualitative research approach to this question. Daniel is very interested in cognitive testing, and he's responsible for cognitive training for the patients. Our patients, we conduct 5 weeks cognitive training program. Philip is very interested in ICF. Annika is interested in sleep disturbances and activity. And Marianne has a very good contact with our insurance board in Sweden. And Susanne Hagman, she's overall. So this is the end of my talk. Thank you very much for attention.
Thank you.